Thank you. Famous last words, letting me take the reins, but thank you so much. I'm really excited to be here. As Jamie said, came to policy really through my experiences as a young parent in the medical field and in the early education field. So, this means a lot to me to see so many people here to talk about this issue. I will say, before I kick things off, what I told people while I was campaigning, what I tell people today is I cannot do the work that I love to do without the accessibility of early childhood education for my two kids. My two kids are in programs currently. Today is outdoor exploration hike for the preschooler, and tomorrow is May Day hat parade for the 2-year-old. So, lest you thought your weekend was getting started off fun, you wish you could be her this weekend. We are talking about early childhood from so many different aspects. And I just want to frame that for everyone. When we talk about investment, we're talking about what this can do for Delaware as a whole. And that's the pitch that I make to my colleagues when I'm in the General Assembly, that this isn't an economic argument. This is a way to create career paths for workers. This is a way to bring workers back into the workforce. So many parents and especially moms who face so many forces that bring them out of the workforce. These are the types of policies that are going to get them back there. And then, of course, we can't forget about our littlest students and making sure that they have the access during those formative years, 0 through 3 especially, and making sure, I'm sure as Rebecca will tell us, that the early intervention stage is so critical. So thank you so much for being here. I'm just going to get us started to hear from these amazing advocates and industry leaders. I'm going to start with Retta. And hopefully you can share with us a little bit about your experience prior to March 2020. We feel like we've learned so much through the pandemic, but we also know that even before the pandemic, we were facing a critical crisis in early education. What was it like then, and how have you seen, how has the pandemic brought all of that to light?
Okay, well, the workforce was already struggling prior to the pandemic for reasons that Ms. Jamie already talked about, between the low wages as well as the lack of benefits. I think it has to be clearly understood that early ed teachers, basically, we have a great deal of responsibilities. After all, we're entrusted with the care and the education of our youngest citizens. Every day, we're building trusting relationships with children and their families. We're pouring out compassion through positive interactions, creating connections through learning. It just goes on and on. And we handle those responsibilities respectfully and passionately on a day-to-day basis, recognizing that we are not always valued. We are not always respected. We are not always heard. So the pandemic coming along just brought a whole nother level of responsibilities as well as unforeseen challenges. You have increased regulations that you have to follow between CDC, DPH. You have extra sanitizing that you have to do within the classrooms all throughout the day and in a more intensive way. We have limited staffing now because everyone did not want to return because of the pandemic. Some of them couldn't return because they have children. So the hybrid learning, the virtual learning. So with the limited staffing, that meant that many are working additional hours. Then you have the wearing of the personal protective equipment, obviously, and the social distancing. And if I can talk about those two a little bit more, both of those are necessary means in order to protect ourselves. They also create this mental contradiction in the minds of teachers, because with the wearing of the mask, we all know it's hot to have those masks on, but it's very difficult to talk all day with those masks. Language development is huge at this age, it's critical, but yet teachers have to work through those challenges to express themselves as clearly as possible, so they're not always heard clearly by their students. The children as well, the 2 and 3-year-olds, it's hard to get them to wear the mask. And the older students, again, when they're trying to talk, you do not always understand them. So there are difficulties there, along with a social distancing situation. Okay, well, we're in early education, which means that creating trusting bonds is huge. For our infants, of course, we're going to hug and hold them. There are secretions coming at us all the time prior to the pandemic. And now you have this understanding that COVID And in the beginning, no one knew, is it airborne? Is it just like if I sneeze, if I touch, how am I going to get it? And so there was all the anxiety that was going on. And now at this point, I can still say a year later, you have the social distancing that you're trying to create, but at the same time, as an early educator, you have to create, you have to teach how to share. Social emotional growth and collaboration and interactions, but yet you're supposed to social distance. That's, like I said, a mental contradiction. So the teachers right now, unfortunately, the bodies, the brains, they have to adjust to all of these changes. Every day, the brain is on high alert. The fear, the anxiety is true, because what they are saying is that every day I'm coming to work, I have to maintain in my mind an understanding of what is best practice. How will I make sure that best practice happens in the classroom during a pandemic? So, like I said, with those various additional things that you have to do, you also recognize that if I don't wear the mask, if I don't social distance, if I get those secretions all on me, am I keeping my children safe at home? Am I keeping my family? I may have an elder or someone, a relative who's sick. They may have an immune deficiency disease. All of these things are going on over and all day long in the mind, which is creating so much more stress and anxiety, which obviously means that it is much more difficult to maintain the staff as well as to hire new staff.
And I want to ask you too, we think about benefit structures and we think about, you go to work and then you have a situation where you have to quarantine for 2 weeks. And so there are structures, and a lot of folks have benefits that protect them. We know that in early childhood, so many workers do not have the same benefits than we see in many other industries. Is it reasonable to think that, they workers are not going to come back because they don't see those safety nets in this industry?
Oh, yes, yes, it's already happening. Again, Ms. Jamie mentioned about we have highly qualified staff. Um, and at some point prior to the pandemic, and even during, a lot of the qualified staff may leave, unfortunately, for more pay or better benefits. But now, with all the additional stress and the anxiety, I mean, people are having difficult times. There are so many, unfortunately, that are leaving this particular work for this profession and saying, I might as well go to Target, who's hiring for $15 an hour. It's not what they want to do. It's not their passion. And that's tragic, because we are losing people who are saying that this is my passion. This is what I want to do. And isn't that what we want? If my teacher shows up at their best, then that means that the children and the families receive the best. But we are losing them, unfortunately. And to answer your question again, I'm sorry I'm going on too long. The truth is that it is very, very likely that a lot of them will not return for so many of those reasons. Scary.
No, I appreciate you sharing that with us. And, I know from personal experience that I've lost infant carers to, Nemours, which is a great, employer. But, for me, it's tough to see a great teacher who I entrusted with my kids' care, who wants to be with my child all day, loves that work, move to something that doesn't fuel their passion, but ensures that they can put food on the table. And so it's hard to ask our professionals to make that decision. Sean, I wanted to follow up with you, because we heard from Retta the situation that our workforce in early ed is going through. Can you give us a perspective from a provider perspective, the challenges that you and your colleagues have faced with the pandemic, and kind of what you see we need going forward?
Yeah, when the pandemic hit, to build off Retta, the amount of staff that we lost was astronomical. And a lot of staff that didn't want to return didn't return for a multitude of reasons, whether it be medical, they just didn't feel safe, they didn't want to return, or they were offered another position at a different job, whether it be a K through 12 school, or a lot of them just left the industry completely. Um, it it's really difficult to be getting staff into the building. Uh, for the past 9 months or so, it's impossible to get somebody into the building, even for an interview, because, like I said, when we're trying to compete with other industries in K through 12 schools. We're averaging and pay for about $10 to $12 an hour average per year, which comes out to about $21,000 to $25,000. When we're trying to compete with pay in K through 12 school districts and other industries, which are averaging $35,000 to $40,000 starting, and as much as $60,000 to $70,000 starting. So what we're having to do is we're having to build off other things, offering other incentives, signing bonuses, paying for more 401ks, paying for more classes. We've even actually started an incentive program where for every quarter, based upon attendance, the staff will get reimbursed based upon attendance, just to try and get staff so they don't call out. I mean, we're losing staff just for regular call out days that we don't have the substitutes to even just fill in the class. And the issue with that then becomes is that if you don't have the substitutes, we might not be able to open a classroom. And if we can't open a classroom, then the parent is then stuck trying to figure out what they're going to be doing with their child throughout the entire day. And that just gets exasperated with if we have a COVID case and if a parent or a child gets exposed, they're out the next 10 to 12 days. And if you add teachers onto that, it just keeps building and building and building. At one point, in one of our centers, we had to close 4 of our classrooms, and we're a 12 classroom building. And that's 33% of our building. It's a lot. And that's for 2 weeks. And we're not charging the parents during that time. So then what happens is our income gets exacerbated. And then the average the average payroll cost for childcare is about 65% of the total income. That doesn't leave a whole lot of room for margins for bringing in all kinds of other things, capital improvements, making sure the playgrounds is up to save, making sure that we're doing everything that we need to do beyond what the state requirements are requiring us to do.
No, and I think what's interesting is just from the parent point of view, I think so many folks took early education for granted. And when you have a situation where the pandemic hit and it closed, or we're during the pandemic and you're closing a third of the school, that I think hits parents hard. They don't realize that. I think we don't even realize, even employers don't realize how much their employees are relying upon this critical infrastructure and service. And so, no, I'm really surprised to hear that is still occurring. And obviously the workforce development piece of this is going to be critical to making sure we can move forward. Speaking of a reliable resource, I want to ask Rebecca your experience. I know you're in a school district setting. And so obviously it sounds like you were able to open earlier than the K through 12 folks. But what can you tell us about your students and students' families? What was it like to have that resource in September versus what we saw in April when everything was just shut?
Yeah, absolutely. So working in a public preschool connected to the Colonial School District, we follow, of course, the district's guidelines around the return to school plans and reopening. So we did begin the beginning of this year in full virtual instruction. We did go back for like a couple weeks around October and November, but then we went back to virtual almost through mid-January. So it really, like, that uncertainty and all those changes was difficult. And, when we think about the difficulty that brings, it's not just on staff, which of course we feel that, right? Like it's really hard to balance all those changes and all the challenges that come with not knowing where you're going to teach, if you're going to be in the building or in, virtual from day to day. And of course, like no one has been trained to teach virtually or coach families the way that we, needed to do, since the pandemic in, mid-March has began. So it has been a huge learning curve, I think, for everyone. But then when we look at our families, it's definitely been challenging for these families. They require, our children require so much support to access virtual instruction, especially our children with special needs. So it requires families to be there to help them access this instruction. And we know that families are busy. they are working, they are dealing with many other children that they need to help with their virtual instruction too. They, you know, a lot of my children were being helped with grandparents or left with older siblings, or, you know, the parents were being those super multitaskers where they're on their own Zoom call and have their children right next to them and they're trying to help in both ways. So we definitely know that it has been challenging, you know, for staff, for families, but then when you look at our children, like they're going through very big changes, and the adults having the stress that the pandemic, you know, has, like that also impacts them. So it's just been a year of really embracing as much as we can this change and the uncertainty, but it has been challenging. And I can't say that, you know, it's one that, you know, I think staff are tired. I think staff are tired. I think families are very relieved that now that we're open, but there is that uncertainty. Like they know, just like we know, that any day this can change, any day, you know, it can be impacted. And that, as everyone has said, has increased the stress there for sure.
I'm just looking at all the faces who are nodded when you talked about super multitaskers, because I think that everyone on here has been in that situation, you know, of trying to figure out how you do 5 things at once and make sure your kid gets an education. I wanted to follow up with you, Rebecca, because I know your classroom being in the public school setting, you probably see kids from many different socioeconomic backgrounds. And I'm just curious, did you, at the risk of asking something obvious, can you talk about some of the differences you saw and the challenges for different families?
Absolutely. So we've seen, like, from this COVID pandemic, we've seen a huge program impact. So we currently have about 85% of our students that are enrolled have IEPs. And usually we have, like, we go for a 50-50 ratio. So we're looking to have that full inclusion model. And in our program, you know, for the students without disabilities, we actually do have a weighted criteria in some ways with this lottery system, because we are trying to target the peers and families in our community that are in the most need or that need the most support. So the families that may be on purchase of care, SNAP, TANF, these are the families and the children that we reach out to with the invites first. And with the restrictions, with, you know, COVID, you know, our numbers having to be lower and different restrictions like that, it has actually reduced our ability to service children in our community that, you know, do not have IEPs, but they are still high risk, they still have high need. And what's heartbreaking about that is these are also the families then that have less access to resources, right? They have fewer resources. They're not having reliable Wi-Fi, so they can't connect to some virtual programming that might be available, or they're having trouble affording wraparound childcare services or other support. So, you know, while our program has done so much to help with this, like COVID restrictions have really restricted this access and opportunity for lots of students. And I do think that with this pandemic, as we've all said, like, we have learned a lot, right? It's helped us really see the inequities of our systems and the absolute essentialness of high quality early childhood programming. But it also sees what we can do better. And it's time to do better now. So it takes a village. We all see it takes a village to do this work and to do it well. So I think that we really need to continue to collaborate and advocate, which is what we're doing right now, and just champion our youngest learners, because they cannot advocate for themselves. So this is the work and this is what needs to be done.
Thank you. I couldn't agree more. I'm just going to give you Senator Pardee's cell phone number to share that with him. I wanted to move on to ask Phyllis, because I know you said you have about 30 years experience now in this field. So thank you for all of your service. And I'm just wondering, can you give us, you know, an idea of what it is like today in the classroom right now? And, you know, where is early education for those folks in the workforce? And you just have to unmute quick.
Sorry.
Perfect, there you go.
I'd like to start out by saying that early childhood educators are definitely resilient and resourceful individuals. We've had to get involved in areas that we weren't really prepared for, virtual learning. Some of the staff that were hired to care for preschool children and pre-K children were moved into areas of educating the virtual learners, that was very stressful. There were a lot of unknowns, excuse me, a lot of unknowns that these teachers had to learn on the fly. In the preschool area and in the pre-K area, we're seeing a lot of emotional behaviors, extreme behaviors that we believe are part of the emotional upset that children are experiencing because of COVID. And we've had to work really hard at pulling out everything from the inside of us to support these children and their families, being creative in ways to just to help them acclimate through this new way of learning. Like Rebecca mentioned, the masks. We have children who need support with their speech in those areas, and wearing a mask and teaching young children reading and talking and language and all of that is severely hampered by masking. There's nothing much we can do about that, but we're doing our best to be creative and to support these children in the best way that we can. We see families challenged. We've had situations where children need support, but mom's busy, dad's not there. And so we're just really taking on areas of responsibility that in essence are really family-based, but we've had to become that advocate for that family and doing more and more of what needs to be done to help these children experience success in their early learning process. Teachers are supporting each other, but they're stressed. I have to say the stress levels are high. And when it comes to staffing and taking time off, it was funny because I was dropping off one of my grandchildren at a daycare, and the provider said to me, "I know you work at the ELC at the university." She said, "But we're looking for people." You know, would you consider? I said, "Well, I'm okay where I am." But see, that's the problem there, that staffing is challenging. We have the cushion of students at the ELC, university help cover when we need subs, but their priority is their education. So when they have to take time off to get involved with their studies or whatever, or when they're on break, that leaves us stuck. You know, we're having less time off, but more responsibilities on the job, and stress levels are high.
Thank you for sharing that, and I'm sure the university will be glad of your answer to that colleague. But you know, I have as I've learned and talked to so many more providers, as Jamie said, really learned the struggles of finding the workforce. And so, you know, I think a lot of us are focused on how can we fund an education program, how can we fund early ed, but we also have to think about how can we build an infrastructure so that when we fund it, there are people who are there to teach the children in the way we want it to go. And so I'll turn to Madeline, because this is my favorite question, which is, what does an ideal early education system look like for Delaware? What can we do in this field, and what's it going to take to get us there?
Thank you. Well, I think, you know, this panel has laid out some of the critical issues around access, around equity, around supporting the workforce, around quality. And those are some of the tenets of the system, you know, that we all want to see for our kids. So, you know, in terms of reliable access, Sean talked about, you know, having to close classrooms and not even being able to serve the families that he could be serving, you know, today. You know, we need to fix that. Even before the pandemic, we had more than half of Delaware parents saying that the cost of childcare was preventing them from growing the economy. They were not buying a house. They were not going back to school. They were not getting a job. And so, you know, Tracy was mentioning about, you know, women kind of juggling, is it worth it to work? That shouldn't have to be a question. And so, you know, we also saw many more women have job losses during the pandemic and filing for unemployment. And we know childcare is a part of that. So we know reliable access is for the family as well as for the child. And, you know, I think about, you know, public education. Why did we decide that that starts at 5? Why does my kid have a right to education at age 5 when we know their learning, you know, begins way before that? We need to move to a place where learning is a public good that starts at birth. and that we support that in a way that supports, the best environments that support equity and that support quality. So right now, we're not investing as a state in classrooms that support inclusive environments of student. I see some chats about students with individualized education plans and their typical peers. The state's not investing to best practice or even to federal guidelines about those kinds of environments. And we know our workforce isn't able to support all the mental health needs, all the language needs, all the special needs that families have. So we need to do a lot better job just getting access and then making sure that access is equitable and high quality. We all can see the classroom that we would aspire our child to be in, where there's play and where there are strong relationships with adults, and where learning is encouraged for all by all, and supported with those types of environments, including how we pay our teachers. And you've heard a lot about that today, but this is a highly skilled profession. They deserve more than a livable wage. They deserve benefits. They deserve planning time. They deserve time off. And that's all part of the system that we all want to see. So the request today that we're focused on in terms of Advocacy Day is about the state investing more, both in terms of childcare from birth to 5 and high quality pre-K, high quality childcare, high quality pre-K, to support the workforce and those kinds of quality environments that we want to have. And that's really just to get us to a place of stabilization. So don't let anybody think that because we have a lot of one-time federal money to stabilize, that this problem has been solved. We're working on a very long-term issue. Early childhood is invested, we get like a dime for every $1 that K-12 gets. So we have a long way to go. I heard somebody say, we're in a 100-foot hole with a 10-foot ladder. So we got to build a much, much longer ladder over a much, much longer, time frame. And this year's request is just a step to stabilize us and get us to a place where we're paying current rates so that then we can build toward the quality environment that we know we all want.
Excellent. And I'm sure the folks on the call are ready to make those asks. I know a lot of people have meetings with legislators later today, and thank you all for taking the time to advocate on this issue, and make sure that you see in the chat there are definitely pieces of information that you can take with you to those meetings. I'm just curious, I want to ask Sean first, and then potentially, and maybe, Retta and Phyllis to pop in, based on, what Madeline said, as far as the investments we're asking for today. How does that affect you, Sean, as a business owner and a provider in Delaware?
Investments that we really need would be really helpful. I mean, any kind of investments that we can get as far as money being able to put back into childcare would greatly help us in any kind of way, whether it be helping us to attract new staff or being able to put it into capital improvements to improve our childcare system, whether it be providing more benefits for the children, being able to bring in different activities for their whatever the child may need, or different things like that. It would help us significantly in all kinds of ways, being able to provide anything really. Any kind of money helps is what it comes down to at the end of the day.
And I wanted, and also one of the things we probably should have said more during this is the idea that our early childhood education system is mixed delivery. So, we have folks like Rebecca who are in the public school systems. We have folks like Sean and Retta and Phyllis who are in private care, or I guess Phyllis in, educational private care, that great hybrid that's going on at University of Delaware. But, I believe that these infrastructure investments can help across the board. I don't know if Retta or Phyllis, you had anything to add about how these investments might affect your centers or the work that you and your colleagues are doing.
Well, I'm thinking that the investments would surely benefit childcare workers in the way of increasing their wages. I know that for me, being at the University of Delaware has been awesome in that I have benefits. I have an educational benefit. I have insurance, but that's not the norm in every situation for early childhood professionals. The wage is despicable. honestly. And I think that for us who are so very highly trained and so very vital to the lives of children and families and to our nation. I mean, you're preparing the youngest children, excuse me, to be the foundation of our nation's workforce. And the way that early childhood professionals are paid, it's despicable. So I think that a wage increase and benefits and opportunities to further their education and, you know, advance the way that they should in any profession, the way that most people do in any profession. That should be a stable, that should be a priority for early childhood professionals. No one should be expected to stay at a minimum wage their entire career. It's ridiculous.
I agree, and I'm so glad to hear you say that. I think it means that the work that we have planned for this, financial advocacy piece, and then also the legislation that we have planned coming up to address some of these issues, I think is going to be hopefully well received, and hopefully speaks to these issues that you all have shared with us today. I'm going to turn it back over to Sarah Stowens from Rodell, but before I do, I just want to thank the panelists for taking the time. It's been amazing to talk with you all. I hope this is just the beginning of more conversations. And I'll just say for everyone on the call, I hope everyone was incredibly excited to hear our president speak last night about the needs for early education. But let's remember that we have a job to do here in Delaware. One way to circumvent the US Senate is just to get it done here at home. So let's continue to fight locally for what we believe in. And with that, I'll turn it over to Sarah.